Hey everybody, Dr. Jeff back here with another Menopausal Monday. Well, for those of you who don't know, October is Breast Cancer Awareness Month. And the sad statistic is that 1 in 8 women in the United States will come down with breast cancer, be diagnosed with invasive breast cancer. So it's important, and the message today is that screening matters. So the screening guidelines for women start at the age of 40 unless there's another indication such as greater risk of acquiring breast cancer. Should start at the age of 40, and women 40 to 50 should be screened annually to every other year, and women 50 and older should be screened at least every other year. The date at which women stop being screened with mammography for breast cancer is really individual dependent. Some recommendations indicate that by 75, women can stop screening. But I would say that as long as, women continue to live longer and longer, they may want to choose, or they may choose with their provider to be screened after the age of 75. So this message is to all of you women who have not been screened yet, or haven't seen your doctor yet this year. Make sure you're getting your annual mammography screens, or every other year depending on your age. The other screening tool that's often used is called a clinical breast exam, and that is usually done once a year at a preventative wellness check. So again, if you haven't seen your provider in the last year, it's time to get in, because prevention matters. The last screening tool is a self-breast exam. And I think the recommendations for a self-breast exam have changed quite a bit over the years, but a colleague and a mentor of mine once said that when you're doing a self-breast exam, the woman is looking for the big C. And that is not cancer, it's change. So a woman knowing how her breast feels, the architecture of the breast, the lumps and bumps of the breast, how the skin looks, all matters. And so doing a self-breast exam once a month, and if you're menstruating, that should be about 7 to 10 days after your last menstrual cycle is the best time to do it. Once a month is a great way to become familiar with how the breast feels and to notify your doctor if there's a change. So with those things said, I encourage you all to get your exam, and also to make sure you're up to date on your screening. Until next time, we'll see you then.